Ever wondered if you are pronouncing medical terms related to heart disease correctly? It's a question that bothers every medical professional's minds, especially those for whom English is a second language. Pronunciation, especially in the field of medicine, is not just about sounding professional, it's about clear communication. Imagine being in a high-stress situation. You are communicating vital information about a patient heart condition, and a mispronounced term leads to confusion. It's a scenario we all want to avoid. In the sphere of heart diseases, where precision is the most important thing, correct pronunciation can be the difference between effective treatment and potentially harmful errors. All medical professionals strive for accuracy in every aspect of word, and language should be no exception. Mispronunciations are common, but they do not have to be a stumbling block. So, let's delve into some specific terms that are often mispronounced. The first is atherosclerosis. This is a big word, but don't let it intimidate you. Break it down into 5 parts. Atherosclerosis. So, it's atherosclerosis. The root word here are athero, that means gruel or paste, and sclerosis, which means hardening. So it literally means hardening by gruel or paste, which is quite descriptive if you think about it. Next, myocardial infarction. Again, let's break it down into myocardial and infarction. This term means myo, muscle, and cardial, pertaining to the heart, and infarction means the obstruction of the blood supply. So a myocardial infarction is essentially an obstruction of the blood supply to heart muscle. Next, angina pectoris. Angina pectoris. Angina is derived from the Latin word angere, which means to choke, and pectoris is also Latin, meaning the chest. So, angina pectoris describes a choking of the chest. It's a term used to describe chest pain that occurs when the heart doesn't receive enough blood. Remember, understanding the roots of these words can help guide your pronunciation and also give you a better understanding of what these terms mean. It is like having a secret key to unlock the definition of these complex medical phrases. So, let's sum up and go to the next one. That's arrhythmia. This word is derived from a Greek meaning not, rhythmus meaning rhythm, and ear suffix used in medical terminology to denote a condition. So arrhythmia is essentially not rhythmic. So next one, hypertension. Hyper is the prefix meaning excessive or higher, and tension, that means pressure. So hypertension relates to higher pressure. And lastly one, that's stenosis. This term comes from the Greek stenos, meaning narrow, and osis, denoting a condition or increase. Hence, stenosis refers to a nerving condition, right? Stenosis. Okay, so we learned a lot today, haven't we? Remember, mastering these terms isn't just about sounding smart. It's about ensuring clear, effective communication in a field where every word can make a difference. With practice and understanding, you will pronounce these heart disease terms like a pro in no time. Thank you for joining today, and remember, every word counts in the medical field.